Before we get started, this is part 2 of our conversation. If you haven't listened to part 1 yet, I recommend going back to catch up. Otherwise, let's dive right in.
There are different types of telemedicine roles and positions where you are providing remote care and the patient comes into the clinic and there's a nurse who rooms them, and it's a very traditional system. The only difference is that the physician is not in the room with you. They're on an iPad in the room with you. And in that case, they can go downstairs and do their labs, and the process is similar. But you're right in that this situation, it's a few extra steps. But I find my patients to be so motivated, and they know that we're here to help them, and they're willing to do what it takes to get better.
Yeah, and I think we are also very blessed with amazing patients, and I think that is unique because I have worked in a similar environment where sometimes patients were in person with the nurse, and I was the virtual aspect. And so I think that just tells us there's many ways to do this, and there's not necessarily one right answer or right way. And if we're creative and innovative, we can really find great solutions that work for our patients and ourselves. And I would love to start to move the conversation in a direction of how has telemedicine served you? I think that, of course, we're in it for the patients, and we want to serve the patients and make sure we're providing adequate care. But part of being able to provide adequate care is making sure that our needs are fulfilled, especially as women physicians. Medicine has traditionally been very toxic to women physicians, and sadly, many women physicians leave medicine altogether or work less than they might had they been in a more supportive environment. And I think this is an important thing to bring up because a lot of physicians are now women, and especially endocrinologists. 70% of our fellows in endocrinology are women. And more women are going to medical school than men now. And so we need to start thinking about how we can make medicine, and particularly endocrinology, a palatable, desirable specialty for women to go into.
Wow, I love that question because I have nothing but good things to say in the way that it has served me. And I think most importantly, it has allowed me to be in a better place, mentally, emotionally, physically. I'm just a more present person because I've been able to meet my needs, which has translated into all my roles, right? As a physician, as a mother, as a spouse, as a friend, in all my relationships. And that it allows me to achieve some work-life balance. I feel a sense of autonomy. I feel control. I have that flexibility where I feel like I can choose what I want to do with my time, and I control the narrative. And that shift in mindset has allowed me to grow professionally because it's challenged me to make contacts. Like we met and we've connected and have met so many trailblazers who are here to change the trajectory of endocrine care, of specialty care. And just because we are used to this traditional model of care that is not meeting our needs and the patient's needs, that doesn't mean we have to be stuck in it. So it's allowed me to really just be in a much better place than I was in the traditional model. And I'm excited to see where it'll take me over the next few years.
Yeah, I think that it's something I think about a lot. Just because it's customary doesn't make it right. And just because we're told that practice is supposed to look one certain way doesn't mean that that is right for our patients or right for us. And it's important to stay curious for everybody. And it really enables us to consider alternative options. And And I think that as women who are kind of brought up to become career women, I think we have this mentality of, well, we're going to have to pick and choose. You're going to have to pick one or the other, your kids or your career. And there's this big blaring or that I feel telemedicine has changed my perspective tremendously, and direct care. I was reading Simon Sinek's book, Leaders Eat Last, and I love that you brought up control, because he identifies control as the highest predictor of job satisfaction. And I think that's very important. And I think it also is a lens on why many physicians are not satisfied at this time, because they have lost a sense of control over their schedules, their management, what they can prescribe, how they can perform their clinical duties, how they can live outside of the hospital as well. And that loss of control it's frustrating, it's challenging, and after some time it's debilitating too, because we need to have that sense of control, and we've worked very hard to be leaders, right? To lead the clinical team, and we're not given that opportunity in a lot of clinical settings now. But that big or loomed over me, and I used to think about how I wanted to live my life as a doctor, as a spouse, a mom, a daughter, a sister, all of those things. And I just had this big belief that I didn't have to pick. And my mom is a physician. She's an ophthalmologist. And I think that the way life was at that time, or her interests perhaps, there was a big or question. And for me, growing up, I had a great life and upbringing, but I wanted something different for how it looked when I had kids, for my kids. And I never wanted my kids to have less of me because I was a working mom. And this manifested itself in a really big way when I had my daughter. She's my oldest, and I learned right around the time that she was born that breastfeeding was this big important thing that moms are supposed to do for their babies. I was one of the first of my friends to have a baby, and I just didn't know enough. Probably because I was a busy fellow and didn't really think about it too much, or read about it, or do all the things that you probably should do before you have a baby. So I had a baby, and then I was like, oh my gosh, this is something really important that my daughter will benefit from. And there's a lot of things that are unknown on what I can do, but there's pretty solid evidence that if I nurse this child, she will have the best basis or best foundation for a lot of things. And so
a lot of pressure.
It's so much pressure, yes. But that was that big moment for me where I was like, okay, here I am, and I don't want this or. And so it was very important to me, and I really worked very hard to feed her for a year, and I did it, and it was extremely challenging, and I absolutely understand why many mothers find it challenging or unable to do it. But I really felt like I'm a career mom, but my baby is not going to get less than because of me being a career mom. And that has just been something that always goes through my mind when I make decisions. And of course, there are some things that I can't show up for. We're traveling to make this podcast, and my husband was with my kids during this week. There are choices that we make, but they're going to meet us up here today on Friday, and they get to be part of it, and they get to be excited about it. And I think that the control that telemedicine gives us and direct care gives us over our own lives and the culture of our company really enables us to not be like 50% mom and 50% doctor. I truly believe that I'm 150% a patient advocate and 150% mom and maybe not quite 150% wife, probably more like 100 to 90%. Sorry, babe. But I've become more. My capacity has expanded. My heart has expanded. And I feel like we as women physicians have this incredible capacity for compassion and love for everything in our life and for our patients, that if we can put ourselves in positions or create positions for each other to enable that, we will just change the world.
I couldn't agree more, 100%. And I think, just like you said, like professional and personal lives are just intertwined, and you can't have one. You can't have a fulfilled personal life without, I mean, they just go hand in hand. You can have both, and it's important to have both, because I am a better mother and a more fulfilled doctor because I have this culture and this balance that it's a privilege, and I'm glad that I stepped away to find it, because if you don't advocate for yourself and know what you need, you can't meet the needs of others, let alone your patients, your family, your kids, your husband, your parents, your sister, all of the above. So I agree, and I'm so grateful that I'm here on this journey to find what works for me. And this has really helped me change the trajectory of my life in many ways.
Well, let's talk about culture for a little bit, because I think, a lot of companies talk about their corporate culture, but in medicine, we don't. That's not even something that when we're looking for a job, first of all, in training, we are abysmally prepared to look for a job. Right. And that creates long-lasting a domino effect of problems for all of us and all of the physicians to come. And so that's certainly something that we should to work for. But culture is not even on the table, right? Because first of all, most physician jobs don't have a good culture. And two, we don't even know that residency, the culture is awful. The culture is beat you down and make you feel horrible about yourself, and fellowship is that, except times two. And so the concept of a work environment that helps you thrive as a employee or a partner or whatever, as well as a person, is not even really in our vocabulary. But it's important in our company, incredibly important, and we talk about it a lot. So let's talk about why that is important and how the culture really enables us to thrive and live in the way that we want to and hopefully educate and inspire other physicians and women physicians to seek that out or create that for themselves.
Yeah. No, I couldn't, I agree with you. And I find these things, and I've learned the hard way, and you have too. We were in careers and in jobs that didn't serve us. And we, took the liberty to take a step back and reassess. And it brings, I think, the work culture is so important. It's one of those intangible things. You can't put a price on it. You can't put a price on, you can't pay me enough you just can't put a price on the control, the flexibility, people around you who care about things that are bigger than just themselves or the company, right? You want someone who thinks about the patients and how can we improve the quality of care and deliver a bigger message. And that's something you can't put a price on. You just have to seek it out. You have to find it, and you have to. And I'm so proud to be part of a team where we're trying to change the narrative around endocrinology, and we can we can get these bright minds to join us and leverage our skills and our knowledge and our minds to improve the specialty as a whole. And that comes from what, like, the right team, the culture, what the team fosters, which is just a positive environment for patients.
Yeah, a positive environment for patients while also a positive environment for each other. And I think we're lucky to have a team of women, we're all women, that are like-minded in the sense of we're going to go the extra mile for everybody in our life. And that is our patients and our families and each other. And, you know, I don't have to question if, you know, we had a patient emergency this morning and I was recording and they just handled it, you know, and we can trust each other to have each other's backs and to have our patients' backs. And I never have to worry if I am occupied in some way and Munira has to hop on a call with my patient, that she's not going to treat them with the respect that I would expect myself to treat them with. I think that is hugely important. And also respecting that when Munira's kid has a holiday party, she's going to that holiday party. And if that means I have to see her patients, I am happy to see her patients, because seeing a kindergartner or a 4-year-old dance across the stage and sing in the holidays is something that she cannot miss.
Yes.
And even if she's like, oh, I'll see my patients, I'll run a little late. No, like, she's not going to miss that, because that's important. And if she has to miss it, she's going to feel bad about it. And her kiddo is going to make her feel bad about it too. And I want to show up for my kids too. And so I think that we not only do we say, okay, if somebody needs time off or has to make a change for something that is important to them, we encourage it. And we encourage care for
you to show up for your loved one and
yes, and whatever,
and understand your needs.
Yes, and I think that part of the culture, because, you know, being a physician, I remember being in my first job and feeling like guilty if I had to step out to go pee, or if I had to eat lunch, or like, these were things that actually I felt bad about. And I look back and I'm like, oh, you poor thing. You know, I look back on that woman and think, that is not something you should feel bad about. Like, why are you holding so much guilt on things that are unimportant and like you should just do? But it's a culture that creates that. It's not like somebody was actually getting mad at me for going pee. It was that I felt like I was being judged for, you know, not being in my exam room all the time, you know? And so I think culture and environment and the way that we talk to each other and support each other is so important. And Munira actually introduced me or gave me vocabulary for the word, the intangibles. And I love that so much, because endocrinology is a unpopular field, okay? And it's not because it's not a wonderful field. Endocrinologists, many of us love our work and we're very grateful for it. And we love the patient experience. The science is very interesting. It's fascinating. There's a lot of technology. There's a lot of new things to learn. It's a really, really fun career. But in medicine, certain fields are disincentivized because of the salaries, frankly. And endocrinology has applicants to endocrinology are falling because endocrinology is the lowest paying specialty in medicine, and we train as long as some of the highest paying specialties. So when you think of it from a time perspective, if you dedicate 5 years of your life to a specialty and you can earn 2-3 times more for one versus another, most smart people will choose the one that pays more. And many doctors are smart. So people choose the ones that they get paid more for. And it's sad that it comes down to dollars, but this is how people are. Like anybody would do that in any, not just medicine, but any career. You tell me I have to go to school for 4 years to do X or Y, and I can do either. I'm capable of doing either, and they'll allow me to do either. Okay, I'm going to choose the one that pays me more, right? And I'll probably like either one of them. But what has happened is applicants have dropped, but since men are more likely to make career choices based on income, the applications for men has dropped more than women for endocrinology. So that has created this shift in the fellowships to be mostly women, and most endocrinologists look like us now. You know, most of the younger side of endocrinologists look like us. And on one hand, it kind of is like, okay, well, with endocrinology being feminized, we're going to face a lot of things that will make the pay issue worse. Gender pay gap, occupational segregation that says that when more women enter a field, the wages go down, like teaching is an example of that. The motherhood penalty, where mothers are viewed as less competent and less committed and less likely recommended for raises or higher salaries. So all of these things are certainly threats. But at the end of the day, we all knew that endocrinology didn't pay as much as cardiology and orthopedic surgery when we went into this, and we still chose it. And it's not like we didn't have other options, right? And so we chose it because we loved it, and it gave us the balance in our lives that we needed. And also as women, since we kind of know that women don't choose things just based on the compensation, that makes it even more important for us to create avenues where women in endocrinology do get those intangibles, right? They do get that control, that satisfaction from taking great care of their patients, that work-life integration that we can create. So I really think the healthcare system is crazy. Like, the reimbursement structure in healthcare is maligned, and it's not based on technical difficulty. It's not based on what's better for the patients. It's not based on what's cost effective. And so, yes, that's a battle for us to fight. However, in the short term, for endocrinologists, particularly women endocrinologists, we have some options to create avenues that make this a desirable field. Because Munira, like, would you trade this?
No, I wouldn't. My non-compete is up in April. It was 2 years, and I wouldn't trade it for anything. For no amount of dollars would I say, okay, I'll go back, or I'll give this up. And it's exactly because of the intangibles, because it allows me to live my life on my terms, and I couldn't do that when I was in the traditional model. And that brings so much joy, and it allows me to be more present and just a better person, and feel more wholesome and more me.
And that being said, it's not like we're paying a low rate. Like, we're paying. It's not that we're not making any money.
Agreed.
And it is important for us to have a viable business, and it's competitive with other endocrinologists and endocrinology jobs. However, there's a competitive edge when you can offer, okay, I'll pay you as much, but I'll also give you this awesome opportunity to, like, instead of seeing patients 8 to 5 on Friday. Let's fly to Denver and record a podcast together, And I think that we find this fun and exciting. And as a practice owner, there are some months where I don't take home any salary, or very little, but it's okay because we're doing something bigger and better. And there's some months where I make a lot more than I did in a traditional practice. And yes, it takes a unique person to be able to accept that and bear that risk. And that happens to be me on this team. But I think that there are different ways to engage your mind and brain that help you expand in every dimension. And when we can offer other women endocrinologists some of those opportunities, like it was fun to be here together and get our hair and makeup done and like do all this stuff that we would never have been able to do in a different practice environment. So I think that is something that we as a team think about a lot as far as the people that we want to recruit to join us, and the value that we can provide for this specialty and the physicians within it, because we're in a unique position where the laws of supply and demand don't apply in healthcare. There's a massive demand for endocrinologists, yet compensation is not going to change because the market is rigged by the patients are not the market. It's insurance companies.
Yes. And so prevention is not important when that's what we do as endocrinologists. A big part of what we do is prevention, what we should be doing, but we're doing a lot more treatment because we're not allowed to, give the patients the tools they need, and the medications they need to prevent diabetes or prevent
and prevention
obesity
is possible and it's cost effective. It's good for everybody. People like to have their diseases prevented, but the system doesn't allow for that. And the other crazy thing in the traditional setting is that we almost self-select the sickest patients, which I find so incredibly baffling. And I'm going to share a story that I've shared before, but it's just so ridiculous that I think our listeners would love to hear it. So we work with big employer clients. And so whenever we get a new client, I do some reconnaissance work where I try to figure out what the lay of the land for endocrinology is in that part of the country. And we got one new client, and so I was doing the same thing, and I was calling to find out what it would look like for a patient to get into an endocrinology clinic. And basically the long and short of the story was, one, it was extremely difficult to get anyone to answer the phone. Once they did answer the phone, even somebody who had a diagnosis of diabetes couldn't get an appointment, which is like, what else do you need to know? Like, what else do you need to know? And then the requirement was, even if the patient didn't go through their insurance, because I know HMOs do require a referral, the patient would need to see their primary care doctor to get a referral. Then that referral would be sent to the endocrinology office, and that wasn't even enough. Then that office would determine, based on the referral, if they met criteria to see the doctor, and then the appointment would be scheduled. And from that time that the appointment was scheduled to the actual appointment, it was 6 months. That's just crazy. And it makes sense to us as doctors because we understand the shortage. But can you imagine as a customer, or not a customer, a patient, a potential patient, how bad that looks on the doctor?
It's terrible. It's like we don't care about your glucose or 300. I'll see you in 6 months.
Yeah.
I mean, it's bizarre. It's bizarre.
It's just like the patient feels rejected. They are rejected, actually. They don't even, it's not just their feelings. They actually are rejected from our care until, okay, finally you do meet criteria because now you're on dialysis. You know, when really if we saw that patient up front and didn't make it so challenging that they wouldn't be coming to us in such a dire circumstance that we actually can't reverse, but we could have it's highly likely that we could have prevented it. Like, I don't have very many patients that see me early on and then they end up on, I don't think that's ever happened to me, actually.
Or hospitalized. And I mean, our job is to keep them out of the hospital, keep them healthy.
Keep them well, happy, productive at work, doing all the things that they want to do. But it turns into this self-selection of we only see the most complicated patients who are extremely sick. And that's hard too as a doctor. Like, if you're only seeing patients that you can't fix, I think that kind of sets us up for failure, because the unfortunate thing about diabetic complications is once they set in,
it costs an arm and a leg, and it
they're
costs
not reversible.
The employer a lot more than if they would have prevented it in the first place.
Yeah, or whoever's paying for that patient might be the patient themselves. But also they're not. Once the complication has set in, most of them cannot be reversed, but they can be prevented. And when we think about care, a lot of us as endocrinologists are programmed from our training that, that patient isn't sick enough to see us, or like, why are they consulting me on that patient? And I think that is a big flaw.
And I think that's a big thing that I've learned since this year is we screen through a lot of referrals, maybe because that there's such a huge supply of patients that we say, oh, just refer that to OB-GYN or just refer that to so-and-so. But we are well equipped, or if we're not, we can easily learn new things and help our patients. And I've seen that paradigm shift a lot recently in women's health with, in fellowship, you get like a month or two of training for hormone replacement therapy, but if that. And so we were just trained to say, oh, we don't do that, just send to GYN. But when I've taken this step back, it's allowed me time to say, okay, look, this is something that I would love to educate myself on so that I can feel confident and safely and effectively help my patients. And they're women who really need to talk about it, but every time they've brought it up in the past, it's just brushed under the rug, right? So and this is why I think women do well in telemedicine as patients, especially because we can really bring these things up and they feel heard. And we can say, look, your sleep is related to this. Your sleep disturbance is related to this. Let's try this. Tell me more. And I think it's important to challenge yourself and grow as a physician to be able to meet the needs of the patients. And those are evolving.
Yeah. And I think it's very easy to be like, oh, I didn't learn that in my training. But if you're a physician who thinks that way, you're going to really have some problems because medicine is constantly evolving. You didn't see every single type of patient in fellowship. Luckily, we went to very high volume, heavy fellowships where we saw a lot of things, a lot of crazy things that we haven't seen since. So that was fortunate for all three of us. But we have to constantly learn and evolve and see what our patients need and respond to that. And there are ways to do that responsibly, right? We're not here doing appendectomies. Like, it's not like, oh, I'm a doctor, my patient needs an appy, let me just figure out how to do that on YouTube. That's not what I'm talking about. But there are things that we can learn to do within our scope of practice that our patients need. And I love the menopause example. I think there's a huge lens on women's health and the lack thereof. And we can't be asking our GYN colleagues to do all of that work. We have to work as a team, and we understand hormones. That is what we do. We know how these things work, and they might need to spend their time. Okay, some of them may be interested in doing this or want to do this, but I can't deliver a baby. Like nobody wants me doing a C-section, but I can provide a woman going through perimenopause or menopause with adequate education and hormonal therapies or non-hormonal therapies that will make their life easier and better throughout that transition. And so when we can do better, we should do better. And I think it's very easy to shirk our responsibilities and saying, oh, that was out of my wheelhouse, or it wasn't in my training. Or like, even let's not even talk about menopause. Let's say we're talking to a patient and they have an issue that's not necessarily an endocrinology or not an endocrinology issue. Like they have COVID or they have
asthma exacerbation,
and they can't get into their
UTI.
Yeah, something that they can't get into their PCP, or they don't have a PCP. And we have the option of saying, okay, I'm a board certified internist. I took my internal medicine boards and I have the resources and tools to address this problem. Should I do it or should I not? And 9 times out of 10, we can do it. And thus we should. It's so much easier for everyone involved for us to just take care of the patient in front of us. And I know there's a balance there. Like we don't want to be all of a sudden expected to do all of the things that we're not experts on. But I think in the correct environment, we don't see those things as adversarial or a burden anymore. It's just, okay, I have a choice. I can take care of this for my patient. I might have to look up the dose. Like I know this patient needs Augmentin, but I can't remember the dose because I haven't prescribed it in a couple months. Let me look up the dose. I know where to seek that resource, and I can do it and send it to the pharmacy. That's one choice. Or the other choice is to send my patient to an urgent care where they're going to see God knows who, and they're going to get God knows what. In fact, they are going to get a steroid, an antibiotic, something else, an x-ray, like all kinds of nonsense. They're going to, and so I think that creating an environment where we can do better and we do better is so much better for us and the patient.
I agree.
Well, this was such a fun conversation. I want to close with the story of how Munira and I met each other, because it's very serendipitous. Do you want to tell it?
You can tell it. Go ahead.
Okay. So as most of you guys know, I have a pretty active Instagram, and I had gone to my daughter's classroom. Correct. And I was actually livid. This is something that annoys me. It's that every child knows that February is Heart Month, and there's a bunch of stuff around Heart Month. I think most people in the United States are aware of the American Heart Association, Jump Rope for Heart, and all of that stuff. And heart disease is so important. I am excited that people are engaged in heart disease. We have a lot of heart disease in my family. And so I'm not trying to say that is bad, but it annoys me because November is National Diabetes Month. Did any of you guys know that? And there's nothing. And diabetes affects more people than heart disease in this country, and also causes a lot of heart disease and a lot of other conditions. It also is the most expensive condition our country is facing as far as chronic disease. It is a big deal, but nobody knows about it. So I was like, I'm going to make an impact. My kids, classmates are going to know about it, and my kids are going to know about it. So I went to school and talked to, I think my daughter was in 2nd grade and my son was in kinder at that time. And I talked to their classrooms about diabetes in a kid-friendly way, gave them some coloring sheets and things like that. And I think we'd snapped a photo and I posted on Instagram in gratitude for entrepreneurship, for giving me the opportunity to
be able to step away and do that.
And do this and work in an out-of-the-box sort of way and for advocacy. And then Munira texts or DMs me. She slid into my DMs, I should say. And she she was like, oh, that's so cool. I would love to do that for my daughter. And I thought I knew a lot of endocrinologists in Texas, but we had never been introduced to each other. And so I was like, who is this person? And I just had this feeling like if somebody is asking me about that, they must be on my vibe. Like we must share values. And so then I think we started messaging on Instagram, and we were starting to grow the company, and we ended up talking on the phone, and we kind of talked back and forth about it. And she, we jived really well. And Munira, even though we jived well, I did do my background research. And, she had like the most glowing recommendations I have ever heard. Like, I was, by the end of talking to some of our mutual colleagues, they said things like, she's not only the type of physician you want taking care of your patients, but also the type of person that you want in your life and to be your friend. And I was like, okay.
I didn't know this.
Yeah. So at that point, I was like, gosh, all these people, I have to have her. She has to be my friend. And so we were so fortunate that she decided to join our group. And Munira, having you on our team has been even more than I could have expected after those amazing conversations. And I'm so grateful to have you on my team, but also as a friend, like they said. But I share that story because it's a cute story, but also because sometimes it's just going for it, right? It could have easily been like, oh, I don't have any resources, bye, or it could have, or she could have easily.
I wouldn't have even, I could have, I messaged you with no expectation. It just kind of, we just clicked.
Yeah. And she could have thought that was cool, but not reached out about it. And I think leaning into your curiosity and leaning into those people that you're interested in, or those opportunities that may seem out of the box or different, but cool. Some of them will be flops. Absolutely. Like, I've had so many failures and flops, but only through diving into them and experiencing it and trying it will you see if something could change your life.
Yes, I agree.
And I think in medicine, often we're too afraid to do that. And understandably so.
And I think we're taught to ask the wrong questions. But you have to, and that's one thing I've learned is you have to, like when I look for a job, the questions I asked at a fellowship were, when I think about it, they were so insignificant in some ways because they were about things that that's not what my life is about. And so I think it's important to truly ask yourself what is important to you and seek that out when you look for new roles and opportunities.
I think so. And I also think that medical training for a person like me really made me feel like who I am truly in my heart and soul was not the person I should be. And by that, I mean, I was not always the most, I don't want to say academically oriented, but I wasn't the person who scored the highest on our practice boards, or I don't do well in, we have this horrible term, and I almost feel bad even saying it, but in medicine, there's something called pimping on rounds, and that's called put you in your place or put in my place. And it's where your attending just grills you, and the purpose is supposed to be to teach, but maybe that works for some learners, but
it's not constructive.
It's absolutely
in any
not.
way.
Yeah, it's not constructive. And it also, for someone like me, I like to be prepared. Okay, if you ask me to present on something and you give me a few hours beforehand, I will deliver very well and with confidence and all of those things. But if you're going to ask me the number of amino acids in PTH on rounds and I don't know the answer and you just keep staring at me like I'm an idiot, this actually happened to me in my fellowship, like, I'm not learning anything. And just so you know, like, I still don't know the number of amino acids in PTH, and it has never impacted any of my patients' care, and it never will because it's irrelevant. And so I think that the idea of teaching is really a mask for abusing our trainees. And in that type of environment where you're made to feel like you're invalid, and when you push back against it or you think about what's actually important to you, is like that concept isn't even like allowed or admired in any way or important. Like, you shouldn't even feel like your feelings matter or anything like that. That's kind of how we're made to feel in training, that it sets us up for these job negotiations that aren't even negotiations, and potentially, unless we decide to jump off the train, a lifelong failure to know your own truth and to be living a career that maybe doesn't serve you. And when you're not served, like we've said before, you're not able to serve on the same level. And so for other women in medicine who might be listening and medical trainees, I think it's far past time to be having those conversations and recognizing that, one, residents and fellows are people too. And I am still the person that thought differently from the way my faculty did, and I wasn't wrong for it. And so if you're in a situation like that, yes, listen to others who are ahead of you, listen to them and take what you can to grow, but don't feel that what you truly value is wrong and that you have to change yourself in order to survive in medicine, because actually life is not just about survival. It's about thriving, and you can, but you have to be true to yourself.
Yes, I agree. I think that's what I've gained the most from being part of the team and from stepping away from what I was doing before, is gaining this new perspective, which has fueled me in a different way. And I'm excited to just move forward. And I encourage people to do that for themselves, because it's almost harder to do that than to stay be a cog in the wheel. So I challenge you to do that if that's what speaks to you.
Yeah, the inertia to change is very difficult. And sometimes the things that people put you down for are actually your strengths. And that happened to me so many times in training, where people were like, turn that down a notch, turn that off. It actually served me to, not everybody has started 2 companies, and not everybody has a podcast. Not everybody gets to do all of these cool things that I love doing. And it wasn't by turning myself down that I was able to do that. And in fact, it was by turning myself up. So I think listen, learn, and ultimately be true to yourself and listen to your gut, and you will find a way. And like we have, and that path will continue to be windy and change, and I think it's okay to pivot. And I'm excited to see what the future brings for us, and what kind of commentary that you guys have on this show. Munira, is there anything else you wanted to add before we close today?
No, it's just been a great opportunity. I'm so glad that, I was part of this, and I'm excited to move forward, and I'm open to people reaching out and asking questions and learning more about my journey, because it has really changed my life.
Yay. Well, thank you so much for coming on today and for being a part of my journey, and looking forward to more fun things ahead and changing the world.
Yay. Same here.